today's world, healthcare is not just about curing illness. It is about creating experiences that heal, comfort, and build lasting trust. We now move into the session, bringing customer experience to healthcare, a dialogue. Because every patient journey, from the first interaction to the final outcome, is a story of care, compassion, and connection. This session will explore how we can go beyond clinical excellence to deliver experiences that truly matters, where empathy meets efficiency and service meets satisfaction.
It is my privilege to introduce our esteemed moderators for this session, Mrs Rama Rajasekaran, Director of Ganga Medical Center and Hospital Private Limited, a leader known for excellence in patient-centered care. Mrs Rama Rajasekaran, please. And Dr Aparna Jairam, Director of Asavlee, Dr Aparna's Path Lab, bringing a strong focus on quality and patient engagement. With such inspiring leaders guiding this dialogue, this session promises to reshape how we perceive and deliver care. At the heart of healthcare is not just the patient, but the experience we create for them. Over to our esteemed moderators and inviting our speaker for the day, Mr Vikram Cotah, CEO at GRT Hotels and Resorts.
Good morning, everybody. After a very interesting session of a court scene, we are moving into something very different. It was adjourned, but now we are taking it forward. We're really not trying to focus much on patient safety. Of course, patient safety is our goal, but this is going to be something different, where you're going to get a lot of lead points from a very different perspective. So I'm very happy to welcome Vikram Cotah. He's the CEO of GRT Hotels and Resorts, and he's also the independent director of Tamil Nadu Tourism, and was a chairperson of the Travel and Tourism Panel at CI, Southern Region, and also he was a speaker at the United Nations in Bangkok, and he's written a few books on hospitality leadership. So when you look into it, I mean, both hospitality or hospital, the initial experience are very similar. So we're just going to, it's going to get a lot of very important points and information from him, which I'm sure it will be useful for us in our processes of in the hospital. So I'll just ask Aparna to just throw a question at him, and then we can take it forward, make it more interesting.
So thank you, Rama, and thank you, Vikram, for being a part of this. There was a question asked to me, what are you going to do with the hotel industry by my fellow diagnosticians who are here? I think it's everything to do with the industry of hotel, because as we are seeing what happened just before our session, everything is about experience. What patient thinks, how he's treated. Like we know from the time in our industry, I am a pathologist. Even before the patient thinks of visiting a lab or conducting a visit, we have to be present on his phone or on the social media so that the visit gets booked. Even in the hospital, from the time the patient books the appointment and reaches your hospital, and then actual game starts. So I think, Vikram, the question to you is, we have 4 or 5 simple questions. I guess the same things you are facing in your industry. And I'm being very lucky to be a part of your group of hospitals in Chennai for the third time today. And what keeps me coming is my experience, the care, the personalized attention which I get. So I want to know, how are you or your team, uh, if your top management is committed to a particular vision or a mission statement, what we call in our hospitals, how are you ensuring that happens right when the booking starts or when the guest enters your property till the time he takes the bags and goes off to the airport? Can you please share?
So good morning, and thank you for having me among healthcare professionals, doctors. I think it's a great experience for me. Like Dr. Rama said, I think we are very close industries, though we are very different. So I think the question here is, a quote comes to my mind by Mary Angelo. She always says that I learned that people don't remember what you said. People don't remember what you did, but people remember how you made them feel. And that's a very important thing for hospitality. I think hospitality is all about emotion. It's about how you're able to make the guest feel right whenever he comes. I think hospitals are about clinical precision. They save lives. I think the best thing in the world, they save lives. But we pride ourselves in saving souls. I mean, if we are able to do it right, I think the guest is going to go out happy. Uh, I think the question what you asked is very relevant. How do we uh, ensure consistency across the thing?
All levels of
Yeah. So what we do in hotels specifically is that we map the guest journey, and this guest journey starts even before he steps into a hotel. It starts as a dream phase, when he wants to go on a holiday, when he wants to come to a hotel, when he even starts thinking of a hotel, we start reaching out to him. Like you said, through social media, through promotions, through interventions, through CRM. And that's where the CX or the customer journey starts. And then it continues. And the actual, what they say, foot on the ground customer experience starts when he steps into your hotel. And that's where the entire journey starts until he goes away, and then the post journey. So this consistency is very important. I'm sure the hospitals also must be doing it, but they're doing it, they're mapping their journey on processes, whereas we map our journeys through emotions. So every guest, what is he feeling at every touch point? When he checks in, he's anxious. We don't have a welcome ritual which is systemized.
Okay.
We do it at, like a guest comes in the morning with a family, it's a different kind of a welcome rather than when a guest travels 24 hours a transatlantic flight, he comes in the night, we don't make him wait.
Yeah.
He's straight away given a key and he's taken to his room.
So easy
we know
check-in.
he's,
Yes,
he's
very important. Yeah.
So that sort of thinking goes into our processes
Training
and experiences. I'm sure this can be also mapped into hospitals in a big way,
I
and
feel
that can make a very big difference.
Yeah, and also in a hotel industry, people go forward to it. It's something they look forward to it. Hospital, nobody's like to. I mean, it's so the emotional behavior is very different on both situations. So, and how do you really build the trust is very important for you. I mean, as she says, I mean, it's especially to, I mean, I'm not staying in a hotel, but the Radisson, they're continuously saying, you're like all the conference people are staying there, what we are doing, they constantly keep updating. So I just want you to just share a few things for us in the healthcare industries, how we can really, of course, we have to build a lot of trust. That is how we work. How to just get a few tips on what we can implement, especially I think when a patient goes to the room, it's a similar, but it's a different situation. So if you could just share a few tips of how we can use your hospitality into especially when a patient sees the outpatients or, as she says, into the diagnostics, or if he checks into a room
I think like you mentioned, fundamentally, people choose hotels by choice and they choose hospitals by compulsion. Am I correct? I mean,
Absolutely.
yeah. So I think the first fundamental premise is different. But having said that, I think the human being is the same. You can't dissect him saying when he comes to a hospital, he's a different person. When he comes to a hotel, he's a different person. So we have to look at the human beings and we have to look at the emotion. And where we excel, I think, in hospitality is more on empathy. I think we feel more in the shoes of the guest rather than saying, this is our system, this is our policy. Whereas I feel that though the hospitals are changing, they're mapping this into the hospitals, I think the hospital relies more on policy. They're more on clinical precision, accuracy, protocols, standards, policy. Whereas hotels are flexible. We teach our people, look at the situation and act. We don't have SOPs. We don't have standard operating procedures.
Because every situation and
Yeah,
every
because
guest
every
is different.
situation is different and we have to react to the situation. But what we train our people is on outcomes. So I think if you train people on outcomes, if the guest has to feel happy, if the hospital, whoever walks in, the patient has to feel less anxious, what do you have to do? Don't teach it as a process. Teach it as a
With empathy and passion.
experience. So you need to train hospital people to more on outcomes rather than process or
Processes.
systems.
Superb.
I think you can map hospitality into hospitals more easily this way.
Okay, so you know, this biggest challenge is you may have a lot of equipments into your labs or hospitals, but the driver behind it, the manpower, it's a demand, supply, and getting skilled manpower. A is getting the manpower, and B is retaining. Three is keeping them happy. If they are not happy, your guests are not happy. I mean, our patients are not happy. So, just to give you a small example, I think we just were talking. Like, I generally check into a hotel, I don't want to label it here, when I'm in Kerala. And there is a chef who knows my allergies, my stuff, and I feel very pampered, very happy. Suddenly, one day I go and I see, oh my gosh, he's transferred. Now, what do I do? And whole panic thing comes in. So there are hyper guests like me. You may see those people into your hotel as well. So how do you attrition is a part of game. Everybody wants to grow. Everybody wants to maybe migrate. How do you, as a group of hotels, take care that your employees are are happy, are getting challenges into your industry? In short, I'm asking about staff attrition.
I think talent acquisition in a growing economy like India is always a challenge. Because you know that though we say that we have 1.5 billion people, how many people are trained to do service?
Absolutely.
So
skilled
in the service
manpower.
industry, there are very few people, and the service industry is not an easy industry. It's a tough industry. It's long hours. You have to be in front of people. It's a face-to-face industry. You can't do work from home for a service industry. We saw all this during COVID. I think.
Yes, everybody saw that.
Yeah.
Yes, yes.
So having said that, it is a challenge for hotels to retain people, but we believe that the people also have to adhere to, we create a system, an ecosystem, where people are empowered. Uh, so it's a culture. Okay, so we do a culture. So even if one chef leaves, another person takes over. I remember a couple of, during COVID actually, you know, every person had to leave from hotels.
Yes.
And we had a similar situation, like every people had to leave. And we were hosting doctors. The entire general hospital doctors were staying with us.
Yeah, like we were put up at Taj in Mumbai. when
Yeah,
we were
so
doing work.
yeah, GRT Hotels hosted the entire, the general hospital doctors,
Yeah.
and we were giving almost 10,000 meals we were creating and we were giving
Lovely.
to all the nurses, the sanitation workers and everything during COVID. But we didn't have people.
Yeah.
But the people who were actually housekeepers became chefs during that time because we systemized it. If you have to make a sambar rice, you don't have to, you don't need a Michelin star chef to make that.
Right.
So we have systemized the entire thing and we ensure that when there is some person who's missing, that gap is filled in by somebody else. For example, I keep telling my people, we have to build a brand, a culture, where the guest comes to us because we are a GRT hotel, because we are a Radisson hotel, because we are a Taj hotel, not because that chef's Kannan is there.
Correct.
Okay? So tomorrow I can't go to a Taj and say, why is JRD Tata not there? He's passed away. I will not go to Taj. I cannot say that. I go to Taj because I believe that they have given a certain amount of brand promise. Wherever I go in Taj, to their hotels, I get that brand promise. Similarly in GRT, wherever you go to GRT, you get that brand promise. And that's how, and of course, AI and predictive analysis are coming in a big way.
Big way,
Coming to your thing, like you have
Like
allergies.
my next question is that, yes.
Yeah, you have allergies, you have dislikes and wants. And that Chef Kannan may know of that.
Yeah.
But today, when you go in, we have a very robust guest history system. All these are fed in. Whoever, even a housekeeper, a chef, a waiter, when he learns something about you, we have a system which is a mobile base or a desktop. It's all fed in and it all goes into your guest history. And we have predictive analysis. Before, when your reservation comes, your guest history pops up. So everybody in the hotel knows you have an allergy. It's not only Chef Kannan.
So next time I come, I should not be worried Kannan is there or no.
Definitely
My
not.
allergies are taken care of.
Yeah.
So I think the third thing, thank you. So empowering people is what we understand. And I think that kind of synergizes with what we have seen in this industry for 30 years. When you are empowering people and they feel, I think most as experience in HR goes, say 27 years, I have seen people actually never leave for money. There are very few. They leave because they don't have challenges enough in their career to see, growth in the industry or immediate boss, mostly. So I think thank you for sharing that passion. With this riot of artificial intelligence coming in, I call it riot because most of our doctor conferences, we see so many sessions on that. And there is one common thing, it cannot replace us, I mean, all of us are scared, but we are very sure. We also saw one case here right now. So how is that acting as a boon or a bane for your industry?
I was wondering when this AI question will come. I think everyone's talking about AI. Yeah. Actually, nobody understands AI, and I think it's a vast subject. But I think AI is coming in, it's real, and I think it's coming in. Human-centered industries like hospitality, healthcare can never dispense with the human touch. So I think technology is only enabling that. So AI is enabling that. It's assisting. The productivity is going up. Yeah. The accuracy is going up. The precision is going up. But it will never replace that human touch. And I think that's an important thing, and I hope it doesn't. For the first time in my life, I don't want to say how many years, but first time in my life, I had a surgery, the eye surgery. Okay. And it was a robotic.
Now comes the doctor, yes.
And it was a robotic surgery. I mean, I wouldn't have chosen this if I listened to this previous arguments which they had on this stage.
Now you have us, you can ask us, yes.
So, I think I trusted the people more than the robotic arm which came and did that. And I think that's very important. The trust is very important. So still doctors are very important, nurses are very important. That personal touch is very important in a hospital. I remember lying down on a steel bed looking at thousands of lights with that thing, when they do that thing. And I was tense. I mean, it was the first time, obviously. You have anxiousness, you have your fears.
Yes.
And that I think every patient goes through.
Absolutely.
But there was a doctor who just held my hand during the procedure. And she said, everything is happening okay. Don't worry, I think this is the best surgery we ever done. And I just surrendered. And that's the beautiful moment which I think defines how hospitality can be mapped into,
Well said,
into
well said.
hospital.
Yes,
I
yes.
think that human touch is
Very important.
where it makes a big difference, and it can happen across processes. And it can be monetized. I'm not saying this is something which can be trained. Some doctors are very good at bedside manners. Some nurses are very good. It can be systemized. It need not be dependent on people. So I think that this humanness has to come in hospitals. And what I want to tell the doctors in the room or the hospital owners in the room, this can be monetized.
Absolutely.
Okay? Today people pay for customer experience. For example, the priority check-in in an airline, when you go in, you pay that 500 rupees to Indigo
that
and
you
you
can
can
get
go
in
in
early.
fast.
Yes.
Why aren't hospitals using that? I mean, we would love, I remember going into one hospital and endlessly I'm waiting. I'm anxious. I don't know the information. Nobody is giving me information. There are so many people. If there was a service where you say, you pay me 1,000 rupees and I will attach a person to you, a
Vikram,
concierge,
uh,
and then do it. I think it can be monetized, right?
I think before, because there is a buzzer, but I have two questions and very important for our industry. One is, we call it TAT, turnaround time. We are all dying in, we have accreditations, various certifications, and everything comes on human resource, patient safety, quality and TAT. How fast? Even before the sample comes, so that's a very, very crucial point for us as a quality indicator. So for you, when we have so many conferences now, like I feel like starting an event management company with so many conferences done. The biggest pain point for us is when I have 300 all VIP doctors coming to a hotel, we like to have a separate kiosk. As you rightly said, check-in should be seamless. Are mujhe ye de do, wo de do. We try to get the Aadhaar card, the passports even before the guests come. And the hotels, good hotels help us. And the checkouts. Like today, today we had a checkout. Your hotel, I'm glad. They just told me, ma'am, you're done. It just feels good that nobody is scrutinizing whether I've consumed anything from XYZ. That's my first question, so that later on you can summarize. And the second is about franchising. So if you can quickly summarize that for us.
So the first question is that...
How do you handle check-ins, check-outs so that like patient gets discharged from the hospital?
Yeah. So I think the pain points are always when they come in, they're intimidated.
Yes.
The sense of arrival,
Yes.
whether it's an airport or a hotel or a hospital, it's a similar thing.
Yes.
Because you're coming into unknown territory.
And we don't want to be judged.
Yeah.
Acha, why is she dressed like this?
Yeah.
What is it?
So it's very important. You have to make the sense of arrival very seamless.
Yes.
And less anxious. So in hotels, we create concierges who are there to help you when they come in.
I saw that.
They take you to lobbies. They make you sit down. They give you a cup of coffee. In fact, our hotels give you a cookie. I don't know if you had the blue cookie. We give you a cookie. So the idea, can hospitals do? Of course you can do.
Yes.
When airlines are doing, they're handling so many passengers. And they have to also have commitments like you of time. They have to take off on time.
Yes.
They are able to do this to passengers. Why not hospitals? So the sense of arrival is very important.
Very
Another
important.
painful thing for a guest in any service industry is taking out cash and putting it on the table. That's a pain point. It's psychologically a pain point.
Yeah.
So a billing has to be more than the arrival. The billing has to be
Very seamless.
very systemized, very human, and very emotion-led,
Correct.
rather than a policy-led.
Okay, throw it on the bill.
Yeah. So this is your bill and you have to pay this and you go to this counter, you go to this
Don't
counter.
make him work like a government office. Yeah.
Exactly.
Yeah.
I'll pay more if somebody comes to me and says, he explains, these are your bills, sir. You chose this room, this is your doctor fees, this is your anesthetic. Rather than just telling me, you pay this bill and I don't care, this is a thing.
Understood. So handle it with emotion, empathy, and be very precise. And about franchising, so that there's a third bell now.
Yeah.
Sir.
Yeah, franchising is a big subject. I think we need another hour for that. Of course, franchising. In fact, Dr. Mehta was just talking to me about the same subject off the stage. He says, how are you doing this franchising? I think it's very important that if you need to believe that you need to have another person running your brand, you have to buy into that brand. So for example, McDonald's, you know, they are the largest franchising company in the world. They never gave, for the first 10 to 15 years, they never gave a franchise to an outsider. It was only their employee. You have to work in McDonald's even if you're a billionaire, and if you want to own a McDonald's, you have to work in a McDonald's before you start
Parag,
a
that's a
McDonald's.
point for us. Work with me for 10 years, then Asavlee franchise.
Okay, so 10 years you cannot do it right now. So I think a franchise owner has to spend quality time in your hospital to learn
Your
the
culture,
procedures,
yes.
your culture, and mainly the culture.
Yeah.
Before you are giving out your brand to him. Because at the end of the day, he's representing you.
Okay, guys. I think amazing. What I understand here is not numbers as we had yesterday, Dr. Velumani. It's numbers will reach when you have passion, empathy, empowerment, and finally human touch. I think it's lovely, and we are happy that everybody has same fears, right? When you are in the room and everybody is scared, it's nice. Then we know how to grow and everybody can grow. So thank you, Vikram. Thank you, Rama.
Thank you so much.
And thank you, Kaho, for this wonderful
Different
interaction.
Thank you, Ilan, because he made me come here. He insisted that I was here, so thank you to everybody.
Thank you to our moderators and the speaker.